blood pressure and cholesterol correction. So, when it comes to blood pressure, cholesterol, do you believe that, hypertension, heart disease, high cholesterol are due to which of these reasons? Can anyone put in the chat box that what do they think that is the cause of these diseases? Is it genetics? Is it aging? It is untreatable. So whatever, lifestyle. Yeah, Anuradha, that's great point. Do you think it is, untreatable? Okay, yeah, lifestyle. So lifestyle is quite a broad term. We'll talk about, it is treatable. That's great. So is it treatable through medical intervention only? Stress, dietary factors? Yeah, great. Okay, so it is not, okay. Genetics, both. Okay, somewhat genetically controlled. Okay, and both. Okay, and have you changes in lifestyle? Not curable. That's interesting. Yeah. Okay, great. So, so I think, these are some of the aging. Okay, so you feel according to age it comes. Some people are saying, curable. Mr. Prasad is saying it's only palliative, action we can take. That's great. So Dr. Prashanthi will be throwing light on all these aspects, and I'm sure, that will throw up some interesting things in the discussion today. So just to quickly introduce those who don't know Dr. Prashanthi. Dr. Prashanthi is a cardiovascular disease specialist based in New Orleans, US. She has over 18 plus years of experience in internal medicine and cardiology. And she believes, and I would not only say that believe, she actually works with all her patients on diet and lifestyle. And according to her, that is the number one way of, if you have to use the term treatment also, for treating and preventing and reversing heart diseases, which includes, the cardiac problems, as well as blood pressure, cholesterol, and related chronic conditions. She has been getting great results working. She'll talk about some of these cases, that how, she has, is, through the science of nature cure, through the power of making the right changes, they're able to get great results. So with this, I would like Dr. Prashanthi to take over and enlighten us about how this naturally or through, through non-medication route, how we can really cure our conditions.
Hey Ankur, how is everyone doing? Can you guys see me? Because my camera is not saying it's, can you see me, Ankur?
You are visible. Yeah, I can see you.
Okay. I just somehow I'm not able to see myself on that. Hi everyone, how is everyone doing today? So I thank you so much, Ankur, for the warm welcome and the introduction. So some of you know me very well. Some of you are very new to WellCure platform and you don't know me that much. But I'm a regular allopath who has been in practice for a good bit of time. But then somehow it's just my own health issues and everything. I started learning more about natural pathways and stumbled on to nature cures, WellCure, and all that. If you are not familiar with me, I have a post that is written on WellCure website. It's about my journey into health. So you can just read up on it in order to know more about me. So coming back to our heart, we are going to waste a whole lot of time. It looks like some of you are here to know more about high blood pressure, cholesterol. Either it's for yourself or for your loved ones. But is there any specific condition you're looking for? Like what help are you looking for at this point when you came to this program? I just want to know more about information of the participants so that we can help you in that direction. But let's just go over the fact about our heart. So we all know that, right? How our heart is the size of a fist. It kind of beats about more than 100,000 times a day. Male heartbeat is little or like around 70 to 72 beats per minute, and then female heartbeat is around 78 to 82 beats per minute. So the blood vessel system within our body, so each and every tissue is lined up with blood vessels, with capillaries, with all kinds of venous system, arterial system, and all of it. So it's around 97,000 kilometers. So as soon as the conception takes place, around 4th week or so, the heartbeat starts. So remember, like when the ultrasound is going to be done, in order to confirm pregnancy, or if there is an ectopic pregnancy or anything, it's done around 4 to 6 weeks. So body can have. And also, body actually is like the way we are designed. So if there is a blockage in one part, then there are going to be multiple collaterals we call as the bypass channels. For example, when the river is blocked, then what happens? There are multiple bypass channels that form around it. So something like that will happen. So if you really want to observe how your body works, just go into nature and observe nature. It's pretty much whatever nature has externally are pretty much internally. Like our lungs almost look like a tree. Our hands look like like a leaf. When you look at the backside of the leaf, like the venules and all of it. So it's pretty much similar to that way. So here we are in order to learn about heart, blood pressure, and cholesterol, because these are the most important looming problems of what we are facing in this day and era, considering the number of heart attacks we are seeing in young people, or the number of young people progressing more and more towards high blood pressure, many more medications, then going towards kidney transplants and all those, and dialysis, kidney transplants and all that. So blood pressure is the problem that we cannot ever ignore and let it be that way. So let's work on that. Next one. Next slide. So facts about blood pressure is our blood pressure reads like, so hypertension. So every year they come up with different numbers in order to classify our blood pressure, okay? So, but for now, let's take 140 top number, that's a systolic, and 90 your diastolic as the blood pressure number, like the highest. So that's when you have to start looking at other causes, like why is my blood pressure high? What should I be doing for it? So a reality, like 33% of the urbanites and 20. So nowadays, we used to think that the rural population is kind of immune to these kind of chronic conditions like diabetes, high blood pressure. But now, because of their changing lifestyle itself, more and more rural population are also getting into trouble with high blood pressure, heart disease, heart attacks, and all that. So world population, when you're really looking at 66% of the world population, developing countries, they are suffering from hypertension. So as we age, it picks up. But now what we are seeing is a younger population, like even when in their 20s and 30s, we're starting to notice that their blood pressure numbers are going higher up. So high blood pressure usually doesn't create any symptoms for a very long time, because we don't go and check our blood pressures all the time, right? Like who has time to keep checking blood pressures? So it completely goes out of control at some point. Maybe there is a mild symptom of nausea or vomiting, and then one day it's going to be a full-blown picture, either in the form of heart attack, or the doctor is going to say your kidneys are already in trouble, or your eyes are going to have issues in the form of different kinds of retinopathies and all that. So prevalence, actually, this is in Indian population, it keeps on going up. So Indian women are also being targeted, like 22%, because of all the amount of stress they are taking, as well as the lifestyle that they have these days. Even more and more women are also creeping up into this population with this. So worldwide, 1 in 3 adults, they have high blood pressure issues. So what is this high blood pressure? So totally, we are talking about all this allopathic terminology, high blood pressure, all the numbers and all of them. So what exactly is this high blood pressure? How is it coming into our system? So that's the one which we had to start exploring and learning more about it. So the deeper we understand where this blood pressure comes from, then it's easier for us to address it and correct it through lifestyle measures. So let's look into that portion, because most of you all know about all these things. So again, Now we are going to go back to cholesterol, because today we're going to be introducing you to the topics of blood pressure and cholesterol, which are like, people, everybody talks wherever you go to a party or to a get together, it's all talk about blood pressure, or somebody is not eating some food and then going to say, oh, my cholesterol is high, I can't eat this oily rich food. So these are the two pretty much like they have become, they're going together like friends right now at this point everywhere we go. So next slide. So cholesterol, what is cholesterol? It is, we all know that it's like this fatty wax-like substance that is found in pretty much all cells in the body. It's produced by the liver, and only animal products will have cholesterol. So so pretty much like, the more animal product intake we have, the more cholesterol that gets into our system. Animal products include all kinds of dairy products, eggs and meat, and all of them come under animal products. So 25 to 30% of urban population and 15 to 20% have more elevated cholesterol levels. So there is always a range for particular population based on how they live. But nowadays, because of the changes in lifestyle, the numbers are going up in different different age groups and different population groups. So why is this happening? So that's what we need to understand. Next slide. So why is this one? Because you all answered already, right? So lifestyle. So I want to bust the myths today. So blood pressure, just because your grandfather or your father had high blood pressure, it doesn't mean that you are going to inherit high blood pressure. All disease is built upon our lifestyle. It's us. Whatever we are doing to our body is the one that builds up disease. It's not because our genetics have been passed down or the germs have been flying and then they came to us. No. Everything has to do within whatever that is been going on within us. It's all lifestyle related. So let's look at this lifestyle. So most of us, like pretty much what happened with urbanization and the too much of working and all these things, there has been low consumption of fruits and vegetables, especially in the raw form. Can you tell me one raw food that you ate today? At least one raw food that you ate. How much fruit did you eat today? You can put it in the chat. I'll read them later. But eating out and ordering in more, when was the last time you ate out? Like this past week? When was the last time you ordered some food from outside? Influx of processed food products. When was the last time you opened a bag of chips? And then stress and sedentary lifestyle. How much exercise did you get? How much sunlight did you get? How much fresh air did you get? How long have you been sitting in front of your desk job, for 10 hours, 12 hours, maybe taking small bathroom breaks, but how long have you been sedentary? Are we supposed to be living this way? That's the main question that we all have to pose to ourselves. And again, unhealthy living conditions, exposure to pollution, lot of smoking, heavy use of tobacco. Actually, tobacco use has gone down in the Western countries, but alcohol and other drugs are increased. But I think in India, tobacco use has gradually crept up and it is increasing more and more in urban population. So one fruit a day is not enough. We're going to talk to you more about how much fruit need to be eaten. So looking at this picture, how many of you can relate to this picture? If you're North Indian, it's going to look a little different. Your plate will look different. This is a South Indian thali. But how many of us eat like this every day, like pretty much all meals? So for example, let me just go over a typical Indian meal. Tell me yes or no if this is what you're cooking at your home. So morning we wake up around 6 o'clock or so. We do pretty much our things. And then we do tea and coffee at 7:30 or 8 o'clock. Yes or no? Tea and coffee, 7:30 and 8 o'clock. Do you agree to this? Breakfast usually consists of either it's idli, dosa, bread or paratha. It's pretty much we all grew up like this. This is how I grew up. Like my parents used to drink some tea in the morning, and then we used to drink a cup of milk, and then do some idli or dosa and go to school or college. And then we're going to, our lunch used to be a little bit of curry, little bit of rice, and maybe sambar. or it's going to be paratha and some chole or some other curry, dal, sabzi, dahi raita, something like that. Evening when we used to come back home, then it used to be either a little bit of a cup of milk or maybe a banana or so, or sometimes it's going to be some other fried snack like murmura or I don't know what you call those anymore, but murkulu or something like that. And then a dinner around 8 o'clock, pretty much similar to lunch, maybe a little lighter. So this is how we grew up. Yes or no? Like I'll be very surprised if you say you ate a lot of salads when you were growing up or you had fruit for breakfast. So this is pretty much a typical Indian meal. Do you really think when you're going to contrast it to what we are going to do with the dietary changes and everything during our program, but this one we all consider as relatively healthy when compared to the Western standard American diet, which consists of burgers and pizzas. This is a homemade meal, so which we all called it as a relatively healthy meal. But of course, this is super complex on digestion, and also there is not much nutritive value that is left after we cook all this food. So this is where our plates, our taste buds are the ones that eating complex foods, complexly cooked food is the one major cause of disease buildup in our systems, along with multiple other lifestyle changes that happen. So this is where we are going to come into play to help you realize more about how we are eating more complex foods and how we need to, go back to nature as much as we can and eat simple foods. So this is just remember this as an example. Now, processed foods and food products, they're everywhere, they're lurking everywhere. Even though we say it's home-cooked, homemade food, sometimes there is Maggi that is involved and we put a lot of vegetables in Maggi and we kind of pat on our back and say, okay, we ate at home. But again, that's Maggi, which is pretty much processed. Then easy availability, it's cheaper, and then it's convenient. It's much more addictive because of all kinds of junk the natural flavors and everything that they put in it. Again, it's socially and culturally accepted because if you sit and eat a fruit in a corner along with your friends, they're going to say, oh, what is this? You're on a diet or what? But if you open up a pack of chips and pass it along, then you're considered to be the one of the best guys in the group. So this is kind of like has become the norm now. And then how often do we read labels? I think now we are all catching up to that, but in early 2000s and late 2000s, slowly we are trying to, we've been ignoring that, and majority of the MNCs have crept into India. So let me tell you, I came to India in 2008 and then I again came back in 2019 after a decade. I mean, I rarely come back because of other issues that I have at home. So, by the time I came in 2019, I was shocked. Like some of the products on these aisles, they have been banned in West, that we don't even see them anymore, and they are pretty much coming on. They are pretty much all around in India. So they are kind of using these MNCs are using India as a dumping ground to all these complex, extremely processed foods. So do you read labels? Like if you can't spell it, if you don't know what exactly it is, I think it's better not to eat it and put it in our body, because the same thing, it creates a havoc in our system. The amount of salt they put in them, the amount of all different kinds of trans fats and then the additives, this is one of the reasons for a tsunami of health conditions anywhere in developing countries, is eating more and more complexly and adding more processed food products to their diet. So how many of you end up reading food labels, like look at the ingredients, turn it back and read them and put them back on the aisle, put them back and say, it's not safe for me to eat it? How many of you have kids and you don't encourage any kind of processed foods to your kids? When was the last time they ate a bag of chips or something like that? Or, any M&Ms or any of them? How many times has that happened to you? So do you read your ingredient labels? Do you know what to do with them, how to read them? So that's very important. This is a very important part of food education that we all have to go through at this point in order to go through or go get out of this complex cobweb. Next. So eating more out, so fast-paced life, eating with friends, it is the convenient apps. You know, the Zomato is the only one that's coming to. Can you tell me some more apps? Because, you know, you guys, there is a joke, right? You're going to order from Zomato a pizza, then from Swiggy, ice cream is going to come in, and then the salad or the breadsticks are going to be delivered by some other guy because we like different places and we get from different place. I know my cousins do that all the time, like they are younger than me, and you know, they look much older than I am, unfortunately, because of their eating habits. But this has become a lie. Most of the convenience apps have come into place. Nature meant us to physically work for our food, like, you know, walk, climb to a tree, search for food, eat with true hunger. But all those instincts are erased with the help of one single app of a Zomato or Swiggy. So I'm pretty sure some of you have those apps on your phone by now. I hope you get a chance to delete them at some point and then realize what is happening. But I think this takeout culture really needs to end if we really have to take our health into control. Next slide. So, and then now we are going to come to the urban lifestyle. You know, most of their time is spent indoors, or pretty much, you know, they are in high rises with a limited amount of balcony space, and most of the balcony space also has only few hours of sun that is coming in, and no open spaces pretty much in all cities. In all cities, missing culture.
Dr. Prashanthi, your camera is not working. We can't see.
Yeah, because it's saying host has stopped you.
Now it's visible.
Okay. Okay. Lack of open spaces in cities and missing culture for fitness, and then you know, family social responsibility, so many things that are going on. Global work timing, some of you start your work at 2:30 in the afternoon and go on till 10:30 because of they have to work with American times or with European times, and then lots of deadlines. I get to work with a lot of IT folks because, you know, these are the ones who start understanding more. They are the younger ones. They don't want to take medications. They read more upon all these things. So pretty much their lifestyle is so much erratic, and it's not even one single day it's synchronized with nature. So that's where disease builds up. So let's see, how much sun do you get per day? That's the most key important thing. Like, what hours do you get sun? Do you make sure you get enough sun every day on fresh air? Do you stretch as much? Do you try to go to a walk in the park, get some fresh air? And do you ever use some time in order to de-stress yourself and rest your mind? When was the last time anybody did that, or do you pay attention to these things? So Anuradha is saying it's little difficult in the morning to get sunlight. Yes, it is difficult to get, because most of us are getting ready to work or dropping off kids to school. Morning walk daily. How about your weekends though? Weekends are pretty much, or holidays. Instead of engaging in a lot of social activities, maybe if we can focus ourselves more on these things, I think this is going to be the best thing we can do to our health. So we're going to talk more about this in our group sessions and more in the group programs. Let's move. So now we're going to do a simple case presentation. Who is going to get benefit out of this program? I think this program is pretty much for everybody, but who is, for example, there is a case one. This is a 70-year-old gentleman who had undergone bypass surgery. He still has on and off episodes of chest pain with minimal activity. Blood pressure is not well controlled. But they said, okay, you can go home, take these medications, eat a low salt diet, and come back to see us later after 6 weeks. So he's home. He doesn't know what else he has to do, but he's still very scared that he still has chest pain, and his blood pressure is like one day it's up, one day it's down. He doesn't know which medications he has to take and how much he has to take. So zero education was provided at the time, and he was sent home. Then his daughter researched more, came through WellCure pathway, and then she approached us. So we changed his diet and we modified his lifestyle, added more things. We educated him. It's not like, okay, go home, take a low salt diet. We educated him on what a low salt diet means, how he can fix it. We gave him different options of different menus. So gradually his courage, like he became more braver, and then he started working on himself, and then gradually he was able to walk more block. His blood pressure stabilized gradually. Most of his blood pressure medications were tapered off. He lost 20 pounds in the first 6 months. He's much more like, he has more clarity of thought. He knows what to eat, how to live. He's no longer confused about this. And the first thing he would say is, wish I knew this pathway before. I would have never gone under knife or never had bypass surgery done. That's how lifestyle plays a very important role in reversing heart conditions. Now, case 2 is a typical example of majority of the participants who we have today here. So a 38-year-old young techie, he had a recent blood pressure check at health fair that is conducted at his workplace. His blood pressure at that time was 180/90. And he just drank a coffee when he went for his health fair. Okay, so he checked it few times the following week at home. Again, his blood pressure was in the range of 80 to 160, 70 to 80. So he enrolled in lifestyle change program. He quit all processed foods and increased fresh foods. And then a little bit of fasting has been implemented with decent amount of intermittent fasting. And he's been doing lots and lots of raw foods. His blood pressure improved drastically. He's off of, he never took any medications. He was just checking it. Now his blood pressure is around the range of 120 to 130 top numbers, and his weight has dropped to 10 to 15 pounds in 6 months. That was a couple of months ago. That was a couple of years ago. And then now his blood pressure is like on the lower side. He's very much into raw and all these things. So he's doing very, very well with all the changes that are going on with him. He's one of our friends. I need to tell you his story. His parents, both of them have issues with high blood pressure. Dad was on dialysis. So our friend assumed that this is his pathway. See, I inherited this blood pressure from my dad. At one point, I'm going to go on dialysis and all. So all those nightmares were coming back to him at the age of 38, like when he saw his father on dialysis machines. But we explained to him very well that it's not the genes, it's actually the lifestyle or the way they eat, and everything has been passed down from generation to generation within his family, and that's the one that's building up disease in him. So now he's like, everywhere he goes, anyone he meets, he talks about, like, whenever they tell him that they have issues with blood pressure, he educates them about how blood pressure can be dealt with and all that. So this is a typical example. How many of you can relate to this 38-year-old techie? I'm sure we may not be in that age range, but pretty much all of us have gone through that. So I want you to understand, it's not the genes, it's not any of this. It's not. It's the lifestyle that is being passed on from generation to generation within families that builds up disease. Next slide. So what is nature cures is, this is a true simple science, okay? It's the oldest of all natural health philosophies. It is 200-year-old. It's more like an observational health science, and it's not a practice of, like, we don't classify one disease. We don't do any kind of cures or any of these. It's living in harmony with nature's and seasons, resources, body cycles, and wisdom. It's just like putting ourselves back in Mother Nature's lap, and so that she can take care of us, heal our health, and recover us. Nature itself is the best physician. So we just have to, go back to nature, no matter what condition you want to call it. You want to call it high blood pressure, diabetes, high cholesterol, or thyroid, or you name it. Allopathy has so many names to each and every condition. Just put yourself back in Mother Nature's lap, and she can cure you and she can heal you. So it is a drugless system. Today, we don't tell you any kind of drugs or herbs or pills or any magic potions. This is not the kind of science, or not, this is not the kind of course that you're looking at. So it is a drugless system. We're just going to implement natural elements into your lifestyle, and then we're going to help the body to heal it, not help, but take it easy on the body so the body heals itself. So it's a drugless system to restore optimum mind and body health. You're going to be amazed at how well this can be done. So what is a disease? So we're going to learn more about this disease, okay? So toxins build disease, internal hygiene matters. That's a strong statement. Let me explain to you what it is. So unhealthy lifestyle. What is unhealthy lifestyle in the sense? It's not, let's not self-blame ourselves, but like irregularities in our lifestyle, erratic lifestyle, taking too much stress on ourselves, putting too much stress on our body builds up toxins. So there are toxins in everyday wear and tear, okay? Even when you're breathing itself, you're going to, what do you develop in your body when you breathe in and out? Carbon dioxide, right? So the carbon dioxide, once the calories and everything are burned, carbon dioxide is generated. What happens if you keep that carbon dioxide inside you and not let it out? What happens to you? So we become sick, we become acidotic. That's when we start to, our organ systems are going to start failing. So the toxins need to be removed. So if you are a sage who is living in pristine Himalayas, you're going to have this much of toxin buildup. But if you are an IT tech living in Bangalore, working 24/7, you're going to have this much of toxin buildup because you never give your body a chance to let out the toxins properly. So toxemia, whatever condition it is, as more toxins build up, it manifests in the form of different kinds of diseases. Toxins are let out by our kidneys, by our lungs, and also through our skin. Those are the main organs of excretion, and our gut has to be in a very good health in order to maintain this proper environment in order so that the body gets right amount of nutrition as well as the right amount of digestion in order for the gut to maintain its health. So body is self-healing and it's self-maintaining with the right kind of inputs. So the right inputs are natural inputs. So plenty of sunlight, fresh air, pure water, and right amount of food and decent amount of rest. De-stressing ourselves are the most important elements. These are the right inputs so that body has enough time to let out the toxins so that it can heal and maintain itself. So in order for the body to heal and maintain itself, there is no external aid is needed. We don't need anything in the form of medications or herbs or superfoods in order for it. All body needs is these 5 elements, giving it a lot of time and space so that it will let out the toxins and it's going to start feeling better. So please understand this concept because this is the most important part of Nature Cures principles, okay? None of the health systems, either you talk about allopathy, you talk about homeopathy, Ayurveda. I don't know much. Ayurveda maybe talks about toxin buildup, but it's little confusing way. But this one gives you a lot of clarity. Toxins that are built up in our systems are the ones that result in disease. Toxins are not like any pollutants or anything. These are nothing but the regular wear and tear that happens in the body. When we don't let them out properly, they build up in our system. Body has some amount of tolerances, so it will tolerate to one point, but when the point exceeds, that will blow up in the form of disease. So when you're looking at health is on this side, disease is on this side, okay? If you have more amount of toxin buildup, you move towards a state of disease. When you have less amount of toxin buildup, you move towards a state of health. So these are all on the same spectrum. Health and disease are on the same spectrum. It's just like how much toxin you built up. You moved from one side to the other. It's like just like a pendulum movement. So on our part, what we have to do is to maintain less amount of toxins so that we always are on the right side of health. Is this clear? Because this is the basis of Nature Cures and this is the basis of Toxemia. So now let's see how much you understood. How do you see and perceive Toxemia? Is it accumulation of toxins in the body from regular wear and tear, modern stressful lifestyle, complex eating habits, gutters in cities that are filled up with lots of chemicals, pollutants draining into pristine rivers, factories letting out chemical fumes into fresh air, and all of the above? What is toxemia? Toxemia is within us. Toxemia is external to us in the nature outside us. So how we are polluting our external environment, that's the same way we are polluting our internal environment. You guys have to have a clarity on this because toxemia is the root cause of all kinds of disease, and that's the principle we follow in Nature Cures. Yes, it's number 4. All of the above, toxemia everywhere, internally and externally, is the root cause of all kinds of disease and issues that are building up around us. Next slide. So let's understand what is blood pressure and what is toxemia. And so blood pressure, so what is blood pressure is the perfusion pressure, right? So blood, it has to be under certain amount of pressure in order for all the tissues in the body to receive blood that is filled up with nutrients, oxygen, so that all the cells can function very well. So blood pressure is very much self-regulated. So it's the wonder of nature, you know, how we are start off from a small cell, and then we have this complexly functioning machine within us, multiple machines, multiple systems. It's like a whole nature is within us. That's how complex nature is. And so she's a good designer, like she has no flaws in her design. So it is body itself regulates. So blood pressure can be different in different parts of the body. So your limbs are going to have, your legs are going to have higher blood pressure when compared to your arms, and also different times of the day. So as soon as you wake up, your blood pressure is going to be a little lower, but during the day, in the evening time, it goes up a bit. Again, because based on the stress, or vice versa sometimes. So temporary situations like stress, anxiety, fear, anything will raise your blood pressure. Females usually tend to have lower blood pressure when compared to men, and children have lower blood pressure when compared to adults. So as we grow older, as the arteries become more thicker, then the blood pressure also goes up. So toxemia leads to disturbed blood pressure. So for example, okay, so what happens with the river, okay, a free-flowing river comes to the city. By the time it enters the city, then the factories are letting out toxins into the river. Then people are dumping plastic waste. Then what happens to the river? It becomes, the free-flowing river becomes so sluggish and sludge-filled, it doesn't flow. Same thing that happens to us. As when we are born, our blood is real decently pristine and clean. But then as toxemia builds up, as the child is exposed to more complex food, more stress, more chemicals internally and externally, becomes sludge filled. So when the sludge is, like when the blood becomes very thick, it doesn't flow. In order for it to flow, the blood vessels have to constrict, like how you do to a hose, in order to increase the pressure of the water hose so that water goes far. So that's what happens. So toxemia, the more amount of toxemia that builds up, either your blood pressure can be high or low depending upon individual to individual. But this is a mechanism in a way, in order to like the hose, water hose, you put a pressure on it so that the water reach far away. That's what the body does too. It kind of like tightens the blood vessel so that the water can reach to far other tissues and perfusion pressure can be maintained. So that's the basic understanding. Toxemia, the more toxin we build up, majority of us show in the form of high blood pressure. Few people show it in the form of low blood pressure. So am I clear on this one? Because until and unless we correct toxemia, there is nothing we can do about healing or recovering your health. No matter how many medications, how many pills you take, if you don't address the root cause, which is nothing but toxin buildup in our system or waste product accumulation in our system, we cannot do a whole lot of magic with our health. Okay. So now, again, blood pressure pills, you know, all these blood pressure pills, right? There are different blood pressure pills like hydrochlorothiazide that lets out sodium in the fluid. Then there are beta blockers like metoprolol, ACE inhibitors like lisinopril, different kinds. Now, I think Ankur stopped here with vasodilators, but now they are coming with different kinds of medications. Even more and more have come out since then. So what happens is initially they look as if they're working, but then what happens is it kind of like the body starts to act on these diuretics and everything. But then the root cause of the problem is toxemia, right? It builds up. Again, you put some other medication. Again, it keeps building up. Then the doctor is going to say, oh, your blood pressure is not responding to 2 different medications. Let's put you on one more, 3 pills, and then the toxemia builds up. What is the end result of this unaddressed toxemia. We never worked on our lifestyle. Toxemia has built up. Doctor has put you on 3 or 4 different medications. How do we deal with this? How does the body deal with it? So as the toxemia builds up, then end organ damage seems to happen. So kidneys are going to get affected by the toxemia. Then eyes are going to be affected. Heart is going to be affected. People end up with strokes because of the unaddressed toxemia. You can make your numbers look pretty for few days or few months with being on medications. Unfortunately, that is the main cause of progression of disease if you don't address it. That's what I label it as. Stage A is when you're diagnosed with high blood pressure, they put you on one medication. After a few more years, the medication doesn't work because toxemia builds up. Then 4 medications. Then the stage C is complication stage. That's when complication happens. And then stage D is death. So this is the way it progresses in allopathy. Allopathy or any kind of medication, a pill system, if they don't address your lifestyle, it's not for you. Please don't please don't go to that pathway. This is the right pathway because here we let out toxins, we bring down our medications, and then we stop them and we start feeling a whole lot better. And our body is going to be thanking us for respecting its boundaries. So side effects of these medications: confusion, blood sugar fluctuations, impotence. This is very high with these medications. And insomnia, people are tired all the time, even though they take their medications, swollen ankles. The list is endless with these. So every pill has multiple side effects. And then if you keep on adding more and more pills, the more and more side effects are going to be seen. So pills are not the answer to the problem. I really wish people understand this and get out of the cobweb of pills, medicating themselves and blood work and going from one specialist to another. Next slide. So let's understand what is cholesterol. So it's a little complex way of understanding. So what is cholesterol is, it's actually a healthy kind of a thing. It's not a villain in the system, okay? So cholesterol is needed. Each and every cell in the body needs a little bit of cholesterol. Then cholesterol is needed for vitamin D synthesis, lot of hormones, for the optimum functioning of the brain, and all these things, cholesterol is needed. So it is made in the liver. And then liver, whenever it needs it, it is produced by the liver from whatever fats and the food that we have. Most of the time, it comes externally from animal foods and everything. And then what happens is, toxemia is nothing but acids in the system, okay? As the acids build up in the system, in order to neutralize this acid, body secretes cholesterol like a base. So this acid and cholesterol base, they react with each other and they form these plaques. Otherwise, what happens is, with all the acid build up, our body is going to, like the organs are going to take the beating, they're going to burn down. So in order to control that, these plaques are formed. So if they're formed in the neck, and then if they break off and go to the brain, we call it a stroke. If they form in the heart, and if they break off and go to the heart tissue, then we call it a heart attack. So these are all protective mechanisms, but at some point, even body can't take the insult and the assault anymore. That's when these plaques break off. So high cholesterol is a precursor for heart disease, coronary artery disease, and blood pressure buildup. So this is the way. So cholesterol is not the villain in the system. We need cholesterol. We cannot strip our body off to zero cholesterol. So people do all kinds of, like, now there are even like different kinds of shots and everything that have come up, and then there are multiple pills and everything. But statin medications and all those things are also there. So this is what it is. So this is what it is. So then different kinds of medications, there are types of cholesterol medicines, are statins, cholesterol absorption inhibitors, PCSK9. These are all different names. I'm sure all of you know a few of them. Then side effects are brain fog, and then forgetfulness, cramps, constipation, itching, bloating. It's not only this, the muscle aches, and then the dementia or the memory issues and then the liver problems with statin medications is on the rise. So we have to be really careful. These things are like almost like taking chemotherapy drugs. So we have to be careful with such things. Next slide. Anyone taking any kind of statin medications, cholesterol medications or anything? So when a person says they have diabetes, high blood pressure, thyroid, high cholesterol, coronary artery disease, etc., what does this mean? It's a toxemia from modern lifestyle. They have huge issue. They have huge issue with one particular organ, and rest of the body is fine. Just take pill for that disease. It is just hereditary or age related, and they can't do much. They should take these medications forever. So what do you think now that I explained to you about what toxemia is all about and how things go and what happens? So how do you think now? Now that you have an understanding about toxemia, waste buildup, and what happens to this, so is it a toxemia from modern lifestyle? They have huge issue with one particular organ and rest of the body is fine. So just take the pill for the disease. Is it just hereditary? It's age related that they can't do much, or they should take those medications forever? Yes, toxemia is from it's modern lifestyle disease. They have issue with one particular. They don't. Actually, toxemia is everywhere. Depending upon which organ is weaker, people manifest it in that form. So, like as I said, underlying cause of all kinds of illness is nothing but toxemia. And no, they should never be taking their pills forever. They always have to come back and address their lifestyle. And it is not hereditary, it's not age related. It is because of waste built up in the system. And hereditary because, you know, what happens is how we eat and how we live and the stress and everything is passed on from generation to generation. So that's how it appears like, okay? So please don't live and don't go back because they're going to say it says hereditary, you have to take medications. That's a myth. We've been able to debunk it multiple times with multiple different participants in our different groups with different conditions, and they're able to live medication free just by adjusting their lifestyle. So progression of blood pressure diseases, progression of blood pressure and cholesterol issues is diseases do not happen all of a sudden. People say, oh, he had a very healthy lifestyle, but we don't know how he ended up with a heart attack and he passed away in his age of 30. No, that's not true actually. But if you really sit down and work with their history, you're going to know more about there have been so many ups and downs. He had a lot of stress and all those things will come out. So toxin accumulation doesn't happen overnight. It takes a lot of time for it to happen, and body has already given us multiple chances in order to recover itself, but sometimes at times we forgot to listen to the body. Circulating blood carries this toxin to all bodies, causing different injuries, inflammation in different blood vessels, many warning signs along the way. So by the time someone develops a complication in the form of kidney condition or eye condition, they had diabetes or high blood pressure even before that, like at least 1 or 2 decades before that, the toxemia has been there, but people ignored it or they just kept on going with their lifestyle. That's when complications develop. Symptomatic treatment, as I said, remember, someone will have only this much of toxin because they're letting out waste easily. Some of them will have this much because there's so much stress, they don't have a proper lifestyle. So addressing it, correcting the numbers, making them look pretty with blood pressure medication or cholesterol medication is not the right answer. It builds up more disease in the form of toxicity from the medication as well as uncurtailed toxemia that's been brewing in the system. So please, if you have any of these conditions, this is the right time to start working on your lifestyle and plan on getting off of these toxic medications. So body is self-healing powers. It is self-repairing, self-maintaining, self-improving. Only thing we have to do is we have to be more responsible. Our body is very responsive. It is adaptive, intelligent. We should never be overriding the senses of body. Okay, reliance on this creative intelligence of our body is nothing but nature cures. So true healing is about learning how to heal ourselves by using natural elements and by slowing down and by resting our body enough. So yeah, when some of you are going to ask me, is Kangen water good? Is alkaline water good? Is Moringa superfood good to use it? Or can I eat garlic in order to reduce my cholesterol? Nothing will work. All these are just gimmicks. They don't work. Body doesn't have all those, doesn't recognize any of these. All it recognizes is natural elements that are provided to it in the right form, and giving it enough rest and time and space so that the waste is going to be removed in a timely manner. That's all we need to know about it, and that's a simple science. No other, like herbs, nothing will work. We just can't do anything.
So, thanks a lot, Dr. Prashanthi. I think you have demystified a lot of things and also brought us some new aspects of linking with the nature cure science, with the with the modern understanding of different conditions, whether it is cholesterol, BP, or heart, and I think you have pinpointed the reason why medicine or modern treatments do not work, or they do not cure or reverse the disease. They probably help manage. They may have certain significance in certain emergencies, but when it comes to prevent or have a long-term reversible thing, there is probably only one way, that is to remove toxemia. And for that, you have to work with the power of 5 elements. So, for everyone to how do they, what is the next step they can take? The 3 options you can take from here. One is to definitely is to educate yourself and work on the prevention strategies. Or even if you have early, issues or developing, then we have a program for you by Dr. Prashanthi, which is e-learning. It's a pre-recorded program, and it has more than 50 plus lessons. It has where she has worked on given the complete understanding. Today was just part of it, but she has detailed a lot in the program. There is a heart-friendly diet plan, about therapies, yoga, meditation. So almost all the aspects of for the hypertension have been covered here, and you get access. So just to give you more details about the program, there are 4 modules. The first is the introductory module, where she talks about different heart conditions, cholesterol, myths, medicine, and side effects. Then in the module about nutrition, where Dr. Prashanthi has covered about what are the different living foods, what is the power of chlorophyll, what are the superfoods for heart health, what about salt? Common query we have. Cooking oil. These are something which keeps on coming about plant-based versus animal-based, acid versus alkaline foods. Which are the foods we should definitely avoid? And then she has put together all the learnings into a proper plan which you can follow. Then comes the aspect about the therapies. This part of the program be done by WellCure health coach Asha. So she has worked on different therapies, and Dr. Prashanthi has also covered a bit about fasting. Then we have about sun therapy, where we talk about sunbathing and other things, spinal bath, uh, earthing and grounding, different hydrotherapies like wet pack and others. So that has been covered. And mind you, all these therapies do not require anything special. There is a certain protocol. There are certain steps which needs to be taken. It can be done without needing something extraordinarily which you can't have at home or access. Then comes the third part, uh, which is about the overall lifestyle correction, where she has spoken about exercise, sleep and stress. We have a yoga module there about calming, breathing, and a meditation practice. So all the dimensions which we feel are required have been covered there. Uh, Now coming to the second option, which is if you have hypertension and you feel pre-recorded something, you want to have a live and learn through a community under guidance of Dr. Prashanthi. So we have a program starting this Saturday, which is a live version of that program, wherein over a period of 1 month, Dr. Prashanthi would and Asha would be doing live sessions where they'll be covering the aspects about diet, lifestyle, and therapies. And there will be weekly diet plans and goals which will be given. You will be guided about tapering of the medication. If anyone has any medication, they'll be guided how to progressively go about it. You will get a recipe ebook, with heart friendly. And any other guidance which one may be looking for based on what is being taught. Now, there would be third category of people who may want to have one-on-one coaching. They may not have time, or they may be a little advanced stage where they feel getting one-on-one attention is what they need. So then we suggest to go for a one-on-one consultation. So in one-on-one consultation, you get 3 live video calls, which is around 45 to 60 minutes each, where you'll get where she will be going through your medical reports. She will be, giving you a customized plan and guided do-it-yourself natural therapies to support healing. And other things will anyway be available, the right plan and other things she will be guiding you through. So now we would like to share about 2 testimonials from our program. So Dr. Prashanthi, would you like to take us through these 2 cases?
Yeah. So we just concluded this program last month for a bunch of folks who came for a group session. So this is Bhuvana. She's a 51-year-old techie converted into some like another holistic practitioner. So she was having frequent migraine headaches and blood pressure was around top numbers were 140, 145. Bottom was like 195, 95 to 100, something around that range. So she's been on a whole food plant-based diet for a good bit of time. She knows about it and she's been practicing it, but still she was not able to bring down those numbers and her migraines were getting worse. So she came to the group program. So her goal was to bring her blood pressure as well as down to normal range. So experience was, she found that the group was really pretty much like, was more motivating her. There were lots of health discussions that were taking place. And she moved away from majority of her slight indulgences in dairy as well as cooked food. And then that was the main thing. And also that she looked for alternative recipes they provided. They were really helpful. So we were there throughout the program. We were helping her in order to realize where the problems were. We were celebrating even the small breakthroughs that were happening, and we were encouraging and nudging them in order to keep on track as much as they could. So with that, we laid a very strong foundation for them to realize. So now she knows anytime her blood pressure number creeps up, then she has to look back and reflect back on her lifestyle for the past couple of weeks, and then she just has to keep correcting it. Then we showed her how much of exposure, how well to expose to sun, different kinds of exercises, water consumption, fasting, and wet packs. They were all recommended in the program. So she started feeling a whole lot better. Her frequency of migraine migraine attacks have come down, even though she has now and then, but they have come down. It will improve over time. So she's more functional, and then she's able to work better. So she strongly encourages our program because we were there all the time, and we had the techniques that we used were on the discipline that we implemented was a little unique and different from any other programs. Then this Ravi is from Bellevue, Washington, USA. So he's a 42-year-old. He came to us initially because he was the one who wanted to eat some garlic and ginger in order to see if it's going to bring down his cholesterol as well as his weight. So I told him like how it doesn't work, and we enrolled him in the program. So he was in a huge dilemma as what to do when his doctor recommended taking statins to reduce his cholesterol. The doctor has been after him for the past 1.5 years, telling him he needs to be on a statin. So they were telling him to take medications, but he didn't want, as he read about the side effects. And also when he realized that it has to be a lifelong thing, commitment to take this medication, he said, no, I don't want to take it. So he joined our program. We taught him ins and outs. So we told him about toxemia, how the waste buildup happens, how he has to do it. So a lot of unlearning and relearning happened for him during this program, and he was extremely motivated to do it for himself because he wanted to stay healthy for his family. So he knew about the magic of sun, fruits, vegetables, and intermittent fasting. So he lost weight around 35 pounds during the course of the program. He's feeling more alert, his empty stomach, not hunger, but he's feeling lighter, unhappier. So surely he wants to recommend this program if anybody is looking for help with blood pressure, cholesterol. So now his cholesterol, we educated him. He doesn't we don't have to chase numbers. It's how you feel is the most important thing. He's going to go back for his cholesterol checkup after 6 months from now, and we're going to follow it up again and see what is happening. But Ravi has been doing strict intermittent fasting. He just does lots of fruits, lots of raw vegetables, and he does one cooked meal a day, and he's very much motivated to be on track. So he's in some of our groups, so he keeps updating us. So he's been doing very well. So he's completely off dairy, and he's been oil-free since this program, and he doesn't miss any of them because he knows that eating simple can be the best thing for him. So these are the two, but there are many more motivational stories that you can read. So again, Ankur, you want to deal with this or me?
Yeah. So thanks a lot, Dr. Prashanthi. I think, these are just few testimonials. The benefit which people are getting is amazing. And, I think this question keeps on mind of it. Many people, you may have doubt, what is the value of this program? So you have to think about 4 things. How much do you spend on the test? On an average, even a simple test costs you 1,000 rupees. And we know how many diagnostic tests, one has to go through. Some people buy a BP machine, which may be, 2,000, 3,000, depending upon the model which you are taking. And just diagnosing it, it's not resolving it. And how much you're spending on your medication. How much you lose your work, your time with, family, and battling with pains and stress. Many people think that having insurance means health insurance, but that's a misconception. It is insurance. There is only one insurance, that is your own health, not health insurance. So these are like average monthly BP medicine cost around 300 to 500. It will be higher. We have taken just a median level. Cholesterol medication around 300 to 500. Diagnostic tests with doctor visits 4 to 5,000, and a surgery which can be 2.5 lakh to 3.5 lakh. So you can imagine the kind of investment, not only which you got, the time and the pain which one goes through, but also the cost one has to bear. And that's why we make sure that all our programs are very reasonably priced, and we don't see it. We encourage people not to see it as a cost. It is an investment for life. And we never had even a single person coming that we didn't got benefit. Those who were guided and followed, the results are all 100% guaranteed. And you have 3 options if you want to do it on your own. start with it. Then you have an e-learning program which is 679 rupees. Price only valid till 17th June. Or you want to go for a group coaching program which is starting 18th of June, a 1 month live group coaching, which is for 2,000 rupees. In this, we are giving you the access to e-learning complimentary. So that I just want to re-emphasize. And third option is if you want to go for a one-on-one consultation with 3 calls and a continuous one-on-one support with Dr. Prashanthi, the price for that is 5,000 rupees. You can scan the code which is there on the screen and make the payment, or you can pay via a GPay and Paytm number which is there. We've also put the link in the chat. Now we'll take up the questions which people have put up in the chat. If there are more questions, you can put in. So there was a question by someone, Pranab, who said, I have migraine and BP, facing anxiety issues. This is the right program. As Dr. Prashanthi even shared one of the testimonials, the person had similar issues and they got immense benefit. Then Mohinder Pal is asking that I'm here from India, come back next month, but people here at USA, how they can be benefit? They can definitely benefit. Dr. Prashanthi is based in US and we do have participants internationally joining in. So the time is such that whether you are in US or even in European region or India, that's how we have chosen the time, and we've chosen Saturday, which is off for most of you, so that you can be there. And the recordings will also be there in case you miss the program. It will be there, and there will be weekly tasks and everything would be given to make sure that the whole idea of the program, of the group program, is that you really get into the action mode and because that's where the real benefit lies. Meenal, right now we had a program on thyroid correction, but you can't book one-on-one consultation. It's the same price for thyroid correction with Dr. Prashanthi. So it is for anyone. This program, Sahili, it will take you to the depths, take you to make sure that you practically what we are teaching is not just prescribing, but make sure you are able to execute. So all the support, all will be available, including for natural therapies. So Sangeeta, you can just click and pay, and if you're paying by for an e-learning program, within 24 hours you will get the access, and for the group program we'll add you to the group, and you can then become part of the cohort. So a few people have spoken about the what not to eat, like chocolate and few others. That's where the section about foods not to eat would be covered. Few people have asked questions related to medication, like Gauri Swari have asked, is chlorothalidone BP drug is causing cholesterol? Someone is about taking tab Rose-Day. See, this program is about leaving medication. Dr. Prashanthi has already shared that what are the side effects of medication. It is scientifically proven that no medicine can cure a heart disease, they can only manage. And in that management, they cause different conditions. Our idea is that how we can make you medicine free, so that you don't have the side effects and you are able to reverse the condition. So anyone on statin, atropine, any cholesterol medication, they can Ecosprin, whichever it is there, you can join the program, and that's what. If there is any other question, I'll just now check new question. Yeah, sure, Pranab, you can take 679 package. There is a question, Dr. Prashanthi. Someone is talking about that does lower number in BP metrics can be lowered? I don't know what that means. They have to,
He's asking about diastolic pressure. Yeah, all of them. It's all part of toxemia. Yes, we can bring it down as a part of lifestyle correction.
Okay, so then there are few people who have, other problems as well, like type 2 diabetes, which is very common. And same for, IBS and things like that. So Dr. Prashanthi, I think they can join the program, even if they have diabetic, they will be able to do the program or IBS.
Yeah, they can do the program. So they have IBS and diabetes with high blood pressure, or is it like they're looking for different programs for diabetes and IBS? I didn't understand the question, but we do have programs and we do see patients with diabetes and IBS. So whatever their condition are, they can message us and then we can take care of it from there.
Yeah. No, I think their question was if they have hypertension and type 2 diabetes. So
of course, this is the program. It will be correction for all in one.
Yeah, Pranab, you can take the program. So again, there is a question about I drink bottle gourd juice and amla, and that's what Dr. Prashanthi said. That's that is only one small dimension. You have to link through the other dimensions of all the 5 elements. Maybe you are working on one element of the earth element, and what is the sequence when you are drinking this juice. What about other raw foods? What about oil free food? What about whole plant based food? So there's so many aspects just in diet. And then you have other aspects of natural therapies, which are very, very effective, simple but equally effective. So that's what is there. Yes, for someone who's taking 5,000, they can request. We can give them access to the e-learning program as well.
Yeah, Alex, I'll share everything with you.
Yeah. So Mr. Kumar is asking, yes, you can make the payment through bank account. Tanishka, my colleague, Tanishka, can you put the details for the bank account as well, and also send one-on-one message to Mr. Kumar?
Can I answer this question? Likita, can you contact one of us? You're saying good morning, good evening, ma'am. What about type 1 diabetes? Because these cases are increasing. So are you looking in general for some answer, or are you looking for someone who who has type 1 diabetes? Do you mind contacting one of the admins? Because we have a high kids group with type 1 diabetes kind of condition. So we are doing very well with that group. So we can put you through that one if there is a child that is involved with type 1.
And if it's an adult who's suffering, then we suggest a one-on-one coaching with Dr. Prashanthi is the best option for type 1 diabetes. So we've shared the bank details also. Those who want to do a bank transfer, once they've done the transfer, they have to just send an email to us or send a message. We'll get them enrolled in the program. So I think we've answered all the questions. Yeah, so people who have paid the money already, that's great. For e-learning, you'll get access immediately. You have access for 1 full year. And even if at the end of 1 year you still want to renew, we usually renew with no question asked. And so that's not a problem, Sheila. You can start the program on July 4. People who are enrolling and for a live program, we suggest that don't enroll late, because then everything is interlinked. You can access the recording if you can't attend it live, because there are only 3 sessions. Yeah, so great. I think we are also through to the time, and I'll just quickly summarize about the session and the program, and what were the key learnings from the session today. So, the key learning is that toxemia is the root cause, wherein we are being impacted. And then we talked about cholesterol. We talked about what are the different medication and how they are causing the the side effects, and how we can correct the toxemia. This is using the power of 5 elements, and we understand about the body self-healing powers. There are 3 pathways. You can do just a self-paced program, which is available for 679 rupees with 1 year access, where all the aspects of nutrition, nature therapies, and lifestyle correction is there. You can go in for a group live program where you get 3 live Zoom calls in the session, and along with an e-learning program. These are the 3 sessions. You get recordings of the session if you miss. and they're on Saturdays. And if you want to really go for a one-on-one program, then you have this option as well, wherein you will get 3 one-on-one calls over a period of 1 month with continuous support from Dr. Prashanthi. In live program as well as personal coaching, Dr. Prashanthi guides you through tapering of the medication as well. So Pranab, we request if you can put in the query, that will be great. So we'll wait for a second for your query.
So yeah, this is the best program that has been put together. Asha and Anchal and all of us have put together a lot of efforts to do this. But the thing is, like, please do something about whatever it is, whatever program you want to go through, correct your lifestyle, because it's not a nice thing to have some complications down the lane after, 10, 20 years from now. And then at that time, most of the disease that happens, the scarring and everything, a lot of times it can be reversed. We can maintain it with lifestyle, even at that stage, but still, its prevention is better than cure. So this is a simple way of dealing with disease just by lifestyle correction. Pretty much the cost of a movie ticket, right? Whatever there are the group coaching costs. So think about it. And again, it's not going to be a burden to your lifestyle, or you're not going to be overwhelmed with a lot of lifestyle changes. It's going to be a lot of hand holding, and it's going to be a simple way of like making you think and implement things. So it's really that effective. So please make use of this program if you can, and if you have time to do it, and if this is very important for you.
Okay, thanks a lot, Dr. Prashanthi, and we're looking forward for people who've registered to the program, and and I think we'll be even happier that if you share your story, that how you're able to transform, because we know that what Dr. Prashanthi is doing in a group coaching or a e-learning or a personal consultation, the science is so precise and proven that you have to just follow the path and get the results. Thanks a lot, everyone, and thanks a lot, Dr. Prashanthi, for the session today. We'll share the recording also about the session, and looking forward for people to joining in the program. Thank you. Thanks a lot for your time as well. Thank you. Thanks, Dr. Prashanthi.
Thank you. Bye.